is this where you want me to fake scrub in with alcohol?
So what I want you to do is, once you get everything open, you get your gown, I want you to get at least wet. I know you know how to scrub, and so they can see you dry and get to the view. Yeah. Okay. I want to hear you guys communicating to each other. Because you're going to have to talk to people at externships, I hate to tell you.
Alright. Here's my gloves. You're going to have to open, that's going to be my second pair. Okay. My gown. Can you check the screen? Alright, actually, I'll show myself. Holes in it. Oh, no, I think it's going to be over prematurely. This is considered contaminated. Keep a new set. There's this here. Alright, no, never mind. Yeah, no, you can just keep opening. And then, yeah, make sure you put sharps in one spot and then linens and towels on the other. I don't have a preference to where's the lid.
So just stop right there. When you open, just remember that you have to go away. Back and forth. Okay. Okay. Just correct me as I go. You're doing great. Those are awful. I spent 3 hours. They're actually not the right ones. If there's not.
Guys, I'm ready to go get the patient. About how much longer till we're ready for a count?
About 7 more minutes.
Time, 7 minutes. Go.
Nurse.
His name is, you can use it. So it happens, you know, obviously we're going to reuse that one to the best of our ability. How about we just get another one where we wrap that up, okay? Here's a good rule of thumb too, Arlet, too. If you're getting to a point where it's just like, man, this is hard to open up the field, so you got a guy coming in right now. So you just wait 2 seconds and say, Nick, can you grab this from me? Use that to your advantage too, okay? Because some things are just freaking hard to open. We want you to open up as you go along, but use this person to your advantage if it's something that's difficult to get onto the field.
Hey, Brad. I
Or
believe so.
Or is this for the nurse to like?
I think you can pop it open.
Yeah.
Yeah.
This is for the nurse over.
So floor prep is typically for the nurse, so I would put her over by where her medications are so she can get ready to prep later. Just kind of laid off to the side. You used to put in, we'll also need some dressings to ABDs and some silk tape. That's what we'll need.
All right, patient's ready. We have an estimated time.
Wait, this is. It's a weird name.
Miley Cyrus.
Thank you.
What else do you need?
Limiting your motions too is just to prevent like stuff from flying around, dust and so forth, because that can cause contamination.
Yeah, 1 second. open everything. Before you scrub in, can you check the instrument tray for me?
Good. Love it. Oh. Did you see an indicator in there?
Oh. What if I can't see, like, the color?
Then that's a good reason to have double gloves.
Mm-hmm.
And then you have to manipulate something around and look for it. Do you see an indicator by any chance?
I see the indicator, but I don't see the color. Should I double glove right now?
You should always in the beginning double glove.
Okay.
For this reason alone.
Before I touch the sharp.
For anything. First thing you should have done is just put 2 gloves on. The reason is if you contaminate yourself, it's a lot easier to get that top off and then just put a glove on, opposed to then now you have your bare skin.
Oh, okay.
Well, I want you to make sure you know what type of gloves, and when you get out there, experiment with some sizes. Make sure you're comfortable with the glove. Don't wear gloves that are extremely tight all day, or it's going to be, you're doing this for a career. You don't want to be like, miserable the whole case.
Alright guys, almost ready for a count. Patient's ready.
Just about. I need to check the indicator. Dang, no kidding about double gloving.
That's why I asked if you want 7 or no.
Is it too late to get 7.5?
You got to commit now, son. Go. You got to get this count going. Patients coming.
Ruptured appendix.
Anesthesia's looking in the window, very upset why the patient's not in the room right now.
Yeah, okay, I need 7.5. I can't get this.
Okay, good. Motion tracker with that. I know. Well, I gotta get this out anyway. Stop looking at it.
Almost. Which is low. I can't tell.
You're good. It's black. Tray, get the tray.
Check it out.
It's dry, it's good.
Good. No condensation. Good to go. Get used to just yelling stuff out,
Yeah,
okay?
I couldn't hear you, so.
It's dry, it's good.
Outstanding.
Anything else before?
Right behind you. Blades.
Put them right behind your house. Put that in.
Ready for a count?
Doctor is now looking in the window, wondering why the case is not going. Make pretty later. Get that count done. Gather your sharps. Get that tray out. And as soon as you're ready, let's get that count done.
You ready for a count?
Give me 10 seconds. Count it.
So, where did you start? Can you start that instrument count?
1, 2, 3, 4 penetrating teleclamps. 1, 2 non-penetrating teleclamps. 1, 2 mosquitoes. 1, 2, 3, 4 curved hemostats. 1, 2, 3, 4 Babcocks. 1, 2 right angles. 1, 2 long pokers. 1, 2 short pokers. 1, 2 long Alice. 1, 2 short Alice. 1 tonsil, and then 1, 2 what are these?
Did you say
Oh.
1 tonsil?
No, 2. Sorry. 1, 2 tonsils.
I need to see them. Thank you.
and then 1, 2 Kellys, 1, 2 Foresters. That's a needle driver that messed me up. 1 curved needle driver, 1, 2 straight needle drivers, 1, 2, 3 straight needle drivers, 1, 2 straight Mayo.
Sorry, how many needle drivers total?
1, 2, 3, 4. 1, 2 straight Mayos, 1 curved Mayo, 1 Jorgensen, 1 Iris, and 1 Metzenbaum.
Okay.
And then 1, 2, 3, 4 Richardsons, 1, 2 Devers, 1 Ribbon, 1, 2 Vulcan Rakes, 1, 2 Wheatlanders, 1 Gelpy, 1, 2 Army Navies, 1 Adson with teeth, 1
Just give me all forceps total, please.
1 hiding 1, 2, 3, 4, 5, 6, 7. 7 forceps in total. One, I forgot to count the Bovie. That's my biggest mistake. 1 Bovie, and then 1 Fraser, and then 1 Yankauer.
Can I see the Bovie and Yankauer?
Make sure you see the tip of it, okay?
Yes.
Yeah. This, maybe there's no tip.
Perfect. Do you have any knife handles?
Yeah, I have 1 7 and then 1 3 long.
Can you see them?
Yes.
Count complete?
Count complete.
Alright, anything you want to add to this count? Number 3, number 3 knife handle?
We're missing 2 of them from the set.
I'll get 2 of them. Alright. I'll give you some time to set up that mayo, and then the doctor's going to be in about 10 minutes. He's at the lounge. I'll have to go get him because he said it wasn't ready. And Brooks is going to go get the patient and start bringing them in, okay? Arlette, just kind of get over there. You're working with her. I'm not going to go through a count with you, but eventually you both are going to drape the patient, okay? But give me a second to get those knife handles, and then I'll come back in 2 seconds.
Do you need meds?
Yeah. Look, can you set up the mail for me? There's, you probably want to try to cover it. Not the roll, but to cover it, yeah, to reinforce it.
You need it.
It's the safest answer.
+1. And I want to do +2 on your knife handles, which I have back here, okay?
Sally Kane, 1%, expired 3/21. Nice.
To the left.
Am I blind? Oh. I am blind. Wait, how much air did I drop again?
1 cc.
Okay. I thought it was a.
Okay. Oh, God. As soon as you're ready to prep, are you ready to prep?
I'm ready to prep.
Patient's on the table now,
Prepping.
prepping. And then you're going to commence draping as soon as she's done prepping. She's got a 3-minute dry time, and then typically you don't wait for the doctor, and obviously you're going to be with an experienced tech. They'll drape the patient prior to the doctor, unless the doctor wants to come in and drape with you. And it really is up to the doctor's preference, but realistically, doctor's coming in when the patient's already draped and everything passed out. Because
Can you let this open?
You got labs. You got hemostats on there? Yep, Babcock's just in case, yep.
Make sure you have a smooth forceps, one with teeth.
Yep.
You're gonna want a tonsil, medicine balm. Make sure you have a mayo.
Doctor's gonna be, he's coming down from the lounge now. Anesthesia's here. Got the coffee in his hand. Now, listen. Watch where you're walking now. You gotta be very aware. Don't come in. So get your ass out. There you go.
Give Arlette.
Why is Arlette like, you're like way over here and she's over here? You need to come to the middle here. Alright? You're working together here. There you go. Drop it, commit to it, go. What's the next thing?
Towels.
Alright. So hand it, Arlette's the assist, so hand that to her.
And then I do it? Or
you can work together. You let her do one side, you come over and do the other side, right? But which one do you do first is what I'm looking for.
closest to you.
Okay. Make sure your hands are as protected as possible. There you go. And obviously where she prepped is where we're going to work. And obviously we're working there. And that's called a square knob, right, or fenestrated. Now when you try to commit as much as you can here, but since you're there, you can never go back or go towards the incisional site. You can always go back. So right there is.
Oh, really? You can go back?
So I'll give you a good example of what I'm talking about. Is if you give me one, is when you commit to these. I know, I'm just giving you an example, but thank you for that. So when you're doing this, obviously you're coming in protecting yourself, and so that's where I'm going to go. You can come down a little bit and soak it in, or put it downwards, but you can never go towards the incisional site. So sometimes you can push it down, and obviously we want to, once you do that, you commit to this side, and then this side, and then obviously you come around. But you could never go towards the incisional site. If something is exposed, you just redo it with another loop.
So I'm used to Crystal telling us that we can't move it like at all once we place it.
Yeah, I'm telling you, you can, in the sense of you don't want to go towards the incisional site. And when you can come back a little bit and adjust it down just like she did, where she's coming down a little bit. But you never want to push it towards the incision.
Are you doing nipple or are you doing?
She would do the lower, you would do the upper.
I think I did mine way too high.
So what do? First,
Not towards
be
the
careful here.
Mm-hmm.
You're coming in, this is all contaminated. Hey.
Left rib?
Alright.
This I was never good at.
Never good at.
Never.
Be confident.
Is it?
So
Look at the picture.
You see, even Crystal told me that. I'm like, huh?
watch. I want to show you. And obviously we're just gonna, we know the picture, right? It's gonna head. So where's the where are we working on? So here, so basically we're doing a McBurney's point, we're doing a subcostal incision, we're doing a fan instead. We want to try to center that where that's gonna go. So that's really the objective. Leave the tape on because we want to reuse the drape, but typically you ask the doctor, want tape on or tape off? Typically some doctors are yes or no. I like the tape on because it's not gonna go anywhere. As you see, it's gonna, when you lift up, it flips up, right?
This feels weird. And then we'll walk it out like a
Just
regular
drop it.
divorce.
Just drop it.
Well, I don't want you, okay. You're not typically allowed to drop. Does Crystal show you to drop that? It's a big no-no to drop it because what are you gonna do? You're gonna come down here below the field to pick it up now.
I pick up.
I would do it from inside.
I pick up here and hand up, and then that one.
I would not, I'm saying orthopedic guys would freak out if you drop a drape.
Really?
I'm just telling. Reason is because your instinct is to go down here, and I know you probably would come out here, but go ahead.
Over your hand.
Remember to hold it.
What do you do now? Don't wait on me.
At this point, I kind of got no idea.
Arlette, what do you do? You're the assist. You're supposed to help out, know what's going on.
So, in the wrong site.
Better.
So, what do we do?
Are we gonna are you going doctor now?
Sure, let's go on the doctor. Why not? No. The answer is no. So what I want you to think is once you get to this point and drapes are on, we need to get a mayo over this field. We need to start organizing our field. And you need to start passing some stuff off. So you see that stuff in that little basin over there? Go to that side and start passing and tying things off. Nick, your responsibility is just getting your field set up, getting your mayo over the field, pulling up your table, getting comfortable where you're going to be working, preferably not over the operative site. So,
Go to the other side.
doctor is typically going to be working right here. That's before we're going to be working. The assist will be on that side, okay? But make sure you tie it off with what? A chromatic clamp, sure clamp, or non-penetrating clamp? Which one?
For what was the question?
That's the gnarly. What are you going to tie that off with?
This.
Okay.
If you use a clamp, which type of...
Non-penetrating.
There you go. And make sure you pull your table up, Nick, so it's not so out in the distance. The reason is because you're going to have some rep walk just like this.
Mm-hmm.
Oh, that looks nice.
Oh.
Well, make sure there's no gap in between your field.
Okay.
Get that done as soon as you can. If there's
Where does
some
this
walk,
even plug into?
make sure your basin is not out in no man's land. There you go.
Non-penetrating touch.
Yeah.
What?
Do that.
What?
I said, Nick,
Do that.
Is the rate tech is doomed. Is bad.
It's bad.
get another one.
I'm sorry.
Are you going to get in there, Dr. Brooks?
Yeah, I
Oh,
got
both stuff.
Doc, she's going to assist me in the surgery. She's going to be gowning herself, though. I'll tie her in, and then soon I want you to gown the doctor when he comes in, okay? Make sure you introduce yourself. You know, it's just, hey, I'm Nick. I don't know what I'm doing here. No, I'm joking. Just introduce yourself, okay? I want you to get used to doing that, okay? And then we're going to start. You're comfortable? Got your bogey. That looks awesome. Anything else? Anything else you need? You need about 2 seconds. Brooks, you go. Oh, well done.
We did. Oh, we didn't make the. I don't know how to do towel roll for. I have no idea. Hey, Russ, how do you pull the towel for the ties?
like it's already folded, you just tuck it in the crease.
Really?
Like open it. Now, okay, open it all the way. Now open that next fold. No. Okay, that's fine. Yeah. So now
Put it in here.
take your ties out. Is that,
I can't tell.
what is that? Does that have a needle on it?
No.
Oh. Are you sure? Okay, so we need to add that to your count. And then you need ties, pretty much.
Yep. okay?
Good morning.
Good morning, doctor. My name's Nick. I'm going to be your tech for today.
Nice to meet you, sir. Hopefully someone's coming to tie me, and I asked Crystal, but
We can tie you.
Hmm?
We can tie you.
I know, I just didn't want you were already scrubbed in. Pull my hands down just a little bit. Some doctors like to see their hands, so it's easier.
Want to do that?
Please.
Wow, those shoulders, doctor. You've been working out.
Thank you, Nurse Ratchet.
Ouch. Hold on.
Is that the right?
All right.
So.
Crystal can nurse Ratchet.
Wait, you got it?
Yeah, I'm just saying, you're right. Just go ahead. I just
You
want
not
to
finish
point
spinning?
something out. See your thumbs? Either you're going to hide your thumbs or you're going to hitchhike.
No,
Yeah.
I'm in the OR and I don't have a mask on.
Thumbs on things.
Wow, you're fired.
Enjoy your case, guys.
Thank you.
You guys doing a male to female reconstruction?
Appendix.
Oh, that's not as exciting.
It's so 2022.
Oh, is that how they do it?
That's how I'll do it. I'm a badass doctor. Alright, so what do we do here? You're just gonna kind of stand right here. Cameras on, outstand. Lights on. We have a medical student in today. This is Dr. Brooks. She's just gonna help observe. Please be kind to her. What do we do? We're ready to go? What's the first thing we need to do, Nick?
Timeout?
Okay, so give me a generic timeout. Yell it out for me, Arlo.
Bingo, 57, allergies, risk level 2.
Case.
Oh, case. Appendectomy,
Sure. Open.
open.
Any allergies? You said that?
No.
No allergies. Any antibiotics? 2 grams of Ansep. What kind of local do we have on the field? Nick, what kind of local do we have on the field?
1%, expiration 321.
Okay, outstanding. Does everyone know each other?
Hopefully.
Okay.
No.
If not, this is Brooke. She's a medical student. Does everyone agree?
Agree.
Real quick, we don't have any ties. The nurse didn't get us ties.
That would be the worst thing to say. You don't have ties. So I told you a little bit about how to get ties if you're in a bind.
Would we use, just pop them up?
We use a needle driver. This is just a
And we added one.
timeout.
We added one suture to our count.
1 suture plus 1 suture. So right now, calm. So
Take that off.
pull that out. Just pull it to quick release. Put that in your shirt box. Now you have some ties. Organize them now. Okay. So don't just drop that needle down. Like, make sure it's in that one. All right.
Okay.
Because otherwise it's going to get lost in the space, and that final count is like it's gone.
Okay.
And X-rays rolling in, and everyone's angry. Okay.
And then for
I'll
towels,
give you a couple seconds to get that going, because
Arlie, can you organize my suture for me? How many ties do you think we'll need this case?
we'll start off with 2. Okay, make sure you have at least 2. And God forbid I need another one. We'll blame it on this. So I'm just going to say right now, Nicholas, this is your field. If you're asking people to organize your stuff, it is not going to go over well, okay? So make sure you're organized. It's your field. Or let's the assist. She's a first assist. She'd be more than she's going to help you. But if you say, hey, can you organize my sharps box? You'll be like, well, what's going on here? This is your field, okay? You're doing a great job. Now go in the line of 1 and 2. Yeah, make sure it's easier that way. Not 1, 11, unless you're counting by. 11s.
Tens?
Don't overthink it. You're good to go. through.
Explain again.
You like your field? Good. Alright, so we'll go with the local. Local, please. 2 laps up to the field.
Oh, careful. Okay. That scares me.
So you're good. So when you, it's okay, I'd rather you be stabbing you than me. So when you give it to him, I know we did it in timeout, I want you to let him know what the local is.
Okay.
And Zodicane, 1%. So when you write that 1%, make sure you write it in fractions, 1.0.
Okay.
If it's 25%, it's 0.25. So make sure you write it in a fraction, because otherwise, doctor's gonna look at it and go, is that a 1 or is that a, I'm not sure, 17, looks like a 17 to me right now. So make sure they can read it. Reason is also if someone changes out for lunch and they wanna know what it is, they're like, I have no idea. So I know we have skid markers, but try to use those permanent markers, because these will bleed. So the better you write it so they understand, write in fractions, they can really define what it is. Injection, 2 laps of the field to the assist. Come on up here, I'm not gonna bite that much.
2 laps right now.
To the assist.
To the assist. And so typically when injection, go back, put that back, put it on, don't put it on, you just see how you put it on. Okay.
That's alright, would it be?
What's that?
If I stuck the
Table?
Yeah.
Yeah, yes, of course it would. You do that, alright, so you would have to get rid of that needle, but that's good that you called yourself off. Just wanna see you load it up with 1 hand technique. So when you get laps of the field, typically the assist, we wanna isolate where we're going. So typically, just like that, because we're gonna approximate that, and I'll get one on the opposite side. Can I get an Anson with teeth to the assist, please? And one for me, if you have another one, if not, I'll get something that you have. Same blade? With a bogey? So what I want you to do, Arlet, is grab just like that. And put the bogey in. Okay, just want to make sure you have one. You lay the bogey down. So as I'm going down, I want you to, don't drop it. Is that tied off? Doesn't look tied off. So let's stop real quick. Tie this off. So that fell, I mean, it'd be like, we know I need a whole new bogey. And now there's bleeding going on. So you see how that would be problematic. Make sure things are tied off. You have these little things that have holes in them. You can just go run them through there too. So I'll show you that later. That's good. You're good. Not gonna fall. Alright. There you go. Follow me as I'm doing it. So when you grab this, Bradley, you don't want to cause damage to the actual skin, because that can cause a skin. So just very delicately push it just like I'm doing. So then it'll come down. And just follow me along. Okay, good. You put those ties on passers. You know where to do that? Get some light in here.
Is that on the console?
Yep. Dr. Brooks, can you put some light on that? From the light right on here?
Oh, okay.
And then this part I have no idea. Is it just clamping?
I'm gonna show you 1 second. We got a vessel here that we have to ligate. So lay down. So when you do these, I want to pass them, okay? So lay down. Make sure you isolate that blade, make sure you're comfortable with it, it's not going to stab anyone. So we're going to pass this over, so typically I want to pass that, okay? So we have that on a passer, right? So I'm going to pass it under the vessel. The first thing I do, we have, can I get 2 self-retained retractors?
Oh, it's a thing from the video, isn't it? No? Am I crazy?
Can I get a Tabiki, please? I'm sorry, a medicine ball. Is this your field here? Local, we're done, you get it off your field. Okay, don't stab myself. Organize yourself, make sure you're comfortable.
You don't really need these up for unless you ask for them.
Oh, not in case of bleeding.
We got a little vessel that we're gonna tie off that's coming across our field. We're gonna need 2 hemostats. 1 to the assist, 1 for me. Do we have mosquitoes?
Is that something an FA would be able to do, or would you be the cleaner?
The first assist can do both, yeah, you can help
Okay.
out. We wanna help the doctor. Can I get something that claims? Preferably that works. And we're good.
How about a Kirk instead?
I'll try and mix that. Why not? So I want you to hold this. Don't pull my vessel. That's a bone. Hold this one. Don't pull my vessel. Hold them just like that. And do not take those off, okay? Hold them apart. Okay. Can I get a time passer? Okay. Can I get a debate? Please hold this up. Probably should get that the other way. Hold this up so I see the actual. Pick this up, straight up. And when I say take it off, can you take these off one? Not yet, but can you take them off with one hand? We're gonna find out. Okay, but not when I say yes, take it off, okay? And 3, take it off. Okay. That's amazing. That's a 2. That old man skin. Can I get a scissors, please?
Doesn't matter what one.
And that's a bone spine. And I'll take it off as soon as you ask. So it's the helium. I'm going to tell you.
Oh, ileocecal junction.
Very good. So know your small vowel, right? Duodenum, whatever you want to pronounce it, duodenum, and then what?
Jejunum.
And then the ileum. So the ileum is that last part runs right into that cecum. It's called the ileum cecum junction. It's right there. The blood supply is the appendicular. Make Bernie's point. Tell me some going downwards. What are some of the actual muscles and
Rectus abdominis, obliques.
Yeah, internal, external obliques, and the actual transverse abdominis that kind of goes this way. So it's a combination of muscles, especially off to the side. You have a lot of layers, probably 9 layers going down. Good. So we're going to resect this off. Can I get hemostat? Do you have any more ties?
We can reuse a few. Were you tonsil? Am I crazy?
Are you crazy? Is the response. What?
Tonsil.
The jury's out. Maybe I'm crazy. Hold this. Just like that.
Oh, I was crazy.
Just give me one free time, please.
Oh, free time?
And one just assist, please. Or the
Hey, Dr. House, can I take your,
Yes.
table?
Yes. What table?
Thank you.
Yes. Everyone lies. Did you give me the small one?
Yeah, they're all. Want to give you a bigger time?
Please.
Here?
I mean, I got big man hands. So we got this here. Is this going to be dirty when it comes to your field? Nick, if I take this appendix off, is it going to be dirty?
Yes.
All right, where's it going to go when you're done?
Or what reason?
This, right, something that's not going to be on dirty, right?
So get your specimen cup ready.
So you see the actual tips of these. Dr. Brooks. So I see tips. I see the tips. I want to make sure it's not coming out. So I'm going to ligate this off and then cut it, right? Yeah, the test is hard to get fast. Especially when you made something out of nothing. You like your,
About to rip it out.
no. It's the idea when you do opening, obviously you do this twice, you like it twice, right? You're cutting it off. First you cut that blood supply, but you don't have, it's not laying down, right? Then get a curved nail. So it's gonna come off to you, okay? And then, I think that's gonna be dirty, okay? Be attaching.
Which you prefer straight up?
This is 32. Put it in yours. Have a place on there where it's gonna be a dirty spot.
Want me to like
Not your
fold it
ceiling,
in?
not your this.
You can use your other Yes.
So what did you determine is gonna be a dirty spot? Emerson basin, kidney basin, or that one there? Which one's gonna be your dirty?
I use this one.
Is anything in there you need?
For the rest of the surgery, no.
Okay, then that's, from now on, is dirty, okay? Alright, we're good to go. That Babcock's dirty. And if somehow you got it on your hands, or whatever the case may be, you need to take your gloves off. We're considered contaminated now, okay? Take this off. We're going to close this up. You have some sutures? What do you got? I'll get that, that's fine. Can I get another Babcock when you get a chance, please?
You said you're right-handed?
On the right-handed doctor, yes.
I'm not too proficient with loading sutures.
Why not?
I didn't spend the time as I should.
Okay, so it's, I'm gonna show you right now.
Mhm.
2/3, right?
Yep.
Not really, somewhere in that area.
Mhm.
Right, we don't want it all like this, we don't want it like that.
Mhm.
The motion of the sutures, they're gonna be going to the wrist, right?
Mhm.
So, right-handed, it's gonna go down to the left. So, what I want you to do is keep practicing. If it drops, load this up real quick. A rule of thumb is sometimes if I get nervous, I just stabilize myself.
Mhm.
I pick it up like this, I stabilize myself. Put it right in the spot, I take it, and just go right to the doctor. It's at least, it's not a lot of movements of like,
Mhm.
you're not here, it's stabilized, my fat belly is not making it shake, you choke up on it a little bit if you have to. Once you get it in place, just grab it, grab the end of this, and just turn and get to the doctor. It really is that simple. So drop that, reload it as soon as you can. You can be like, hey, reload that up for me, and you'll be like, I'm not very good at loading sutures. Don't say it. Get that right. Good. Got it. And remember, I'm right-handed now. So rule of thumb is,
Mhm.
I'm left-handed now, evidently.
Okay.
So I'm gonna use it like that. So, you drop it, we're going back to basics here a little bit. You should have got a little proficient at this. If not, I want you to work all on this if you're uncomfortable with it. If I'm right-handed, it's facing to the left.
Okay.
If I'm the other way around, I'm left-handed, you just switch it. But you need to make sure you put it on right. Most people are right-handed. But when you pass it, obviously, that needle is facing your chest.
Mhm.
So hold your hand out, right? So that's how you're gonna do it, right? Originally, I hold on to your chest. It's not working for me, huh?
No.
Okay. Alright, so can you pass it like this? Like, so it's facing me, that needle's facing my chest?
Needle's facing your chest.
Yeah. That's good. That's half the battle. So that's what I want you to do, but see how that's a little bit awkward a little bit?
Yep.
I want to be straight up. If doctor corrects it a little bit, 2/3. So pass that to me like you were doing.
Needle to your chest.
Good.
Where's that?
And what do you think you need? Can I get a Babcock, please?
And straight nail for the suture, and then
Give that to the assist for me. The straight nail.
oh, straight nail.
And the Babcock. Put the scissors down. Grab that for me, Charlotte. You're just gonna stabilize this for me. Okay, hold that in place. What type of technique is this? Closing this.
Perch down.
And what do we do? Invert or evert this stump?
Invert.
I'm gonna have Charlotte come over here. Soft, slaps, Ratex. There's the sheet right there. Okay, right there.
Okay.
So grab it and confirm that we have everything. I know you did the initial count, but I wanna make sure that sheet counts too. And make sure you tell me what the names are so we
Are
can.
you ready for a count?
On the field, there was a non-penetrating telephone.
So count how many penetrating teleclamps you have.
So one, two non-penetrating,
Are you sure? Oh yeah, okay.
1, 2, 3, 4 penetrating telephones.
Okay. Sounds good.
You see that red? It's typically one's gonna go through that. That's
So
the
it's good to
toughest
like
thing
get to
there.
his right, and you can see.
The lower is really just. I have the scissors up here.
What scissors? Nuts or straight?
I have a straight nail.
Okay, here's one straight nail.
1, 2 marks on the field, 2 on the nail, so 1, 2, 3, 4, 5 marks.
Mm-hmm.
Suture on the field, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 3, 4, 5, 6, 7, 8,
You
9.
should do
You
yeah.
try to go, you just try to pull it together as much as you can so it stays. The idea is so it's not dehisced a little bit. I know this is just
1, 2, 3, 4, 5, 6, 7, 8,
it's just driving me nuts.
9, 10 radics. Blades, 1, 2,
Surprised it held together.
3 blades. Hypos, 1, 2 hypo. Knife handles, 1, 2, 3, 4.
I should have done that way closer. Back here.
Yeah, and you actually see that it came through. So,
I can't, yeah, I can't
so
really see
can
it.
you come through there? Can you get that out? And actually, just leave it out.
You have to name
See,
it.
that's called the button. That's going to call
Yeah,
scarring.
there's one straight nail up there.
This
So
is, see how there's, you're going in, you're not going to have any scarring right there. That's going to be a big scar.
yeah, they never
I'm telling you, save a patient's life, that's all they're going to be like. Lexan.
I practice on the nails.
So they have one up there.
I was wondering why you're so good at it. Get this in some job aspect, you just practice for fun.
Well, I got
You
the,
should be a first assistant.
I got the supplies from, urgent care that I worked at, just because they knew that I was going to school, they told me to.
You got good hand coordination.
1, 2 long Alice's, 1, 2 short Alice's, 1, 2 skills, 1, 2, 3, 4 pin stats.
Just, yeah, that's good. You're going through the, are you going to break the other ones? Start a little bit further up. You can cut the thread and all your stuff. And now we're going to start all over, or at least start where you messed up
1,
at.
2, 3, 4 penetrating telephone.
Oh my
Because
god.
eventually you're going to have to tuck it down.
Yeah.
Otherwise this will come apart.
So 1,
And it will.
Pretty.
Oh, and this will be his son.
4 articulation, 1, 2 arm knee.
Yeah, I have not done this type of procedure.
Oh, this is my favorite. It's easy.
I'm not like getting far enough in the knee.
It's not like a patient's thing. Actually, probably the closest I've seen is this here. It
And then
does
forceps, you
tears,
just count the total number
especially
of
older patients, it's just like paper.
1, 2, 3, 4, 5, 6,
And then you just get done vinyl. Screw it.
7, 4, 6.
Oh shit.
We'll do it one more on that side and then we'll stop on that side. And before you do it, I'll show you the tie come out. So try to go a little further.
Make sure you check the field. What else besides the suction is up there?
And 1 booty.
Count complete.
Is this where I'm stopping?
And we're gonna do,
One more?
yeah, and then we'll stop on this side. Stop at about right here and then we'll tie this.
Yeah.
Okay.
And then we'll come out the end. Count complete?
Count complete.
Alright, you can start breaking down your table.
Can
Nicholas?
I de-scrub? I'm gonna
Yeah, you guys can take your scrubs out. We're running out of time. Just break down the table. We'll start showing. I like to start seeing you guys finish the case up with dressings and all that, but since we're running out a little bit of time, I want us to get some time to put everything back. And, so, yeah, no, so you just use this as a time. Yeah, grab the very tip of it. That down and do that about 2 more times, more throws. Don't break it. And turn the opposite direction. So that's it. We're gonna cut this one. You don't want to break your knots all with the whole thread on there. Alright, so go through, put the needle on and come through. Like
You
just
don't have like a dog ear?
exactly. What this does is bury the knot. So what you do is you come in here and then come out about right out.
So in here?
Yeah, inside. Not inside the
Oh,
actual.
inside.
Yeah, inside. As deep as you can, as deep as you can, and then come out about as close as you can after. That's fine. Grab that. And then pull it. You'll see how it buries that. That's how it buried it.
Okay, and then you do that.
And then you
other
just
layer.
pull it and then.
I wanna keep going.
You did a really good job.
That looks terrible compared to yours.
No. See, that's right. Screw
I'll
it up
go
there.
over.
That's good.
That's bad.
That's bad.